Hi, welcome to AM Health Hub. Today, I have a special guest with me, Dr. Hisham Hakim. Doctor is a neurologist from American Spine Center. Welcome, Doctor, to the special show.
Thank you very much.
So let me come to about your hospital, American Spine Center, right?
Yes.
There are so many specialty doctors are available here. So if a patient comes here for a treatment, how you are comparing the different specialties of doctors for their curing?
Yeah. All our physicians are in the field of spine and joint. We have neurosurgeon, we have orthopedic, we have sport doctors, we have, of course, neurologists, and we have vascular doctor, and we have medical doctor too to check on this. So most of the time when the patient comes in, we look at his case, we discuss it among ourselves, and then we put the best treatment plan for them. And that's why, we are not one doctor plan, we are really team. And that's what I like about this. And this is the culture of American Spine Center. That really is a team effort that we put together and we discuss it, and then we put this. And we are very big on treating him with using stem cell therapy, which really, as I said, not only decrease the inflammation, but repair the injury. That's very important because, this has become affected and injured. And remember, this over time becomes smallly dehydrated and becomes smaller, and depend about the stages. So you can have a, mild bulging disc like this. Mm-hmm. You may have a completely disc herniation, but if you do not...
So the red one is completely out, right?
Completely out.
And this one?
Small bulge.
That means you reduce...
Stage 1.
Oh, stage 1. Okay.
Yeah, stage 1. If you may go stage 2, and you may go all the way to the last stage and what called stage 3, where the disc completely disappear if you do not take care of it. And that's very important. So it's very important to understand by tolerating the pain versus treating the underlying condition.
So what is the best stage for starting the treatment? You see, this is the last stage. If a patient reached this stage, do we have the solution for this one over here?
The patient come to us at different stages. They come to us, say first time, they may come up with most of them come with significant pain. We are specialized in complicated cases. And really we are very good at that because we have multidisciplinary approach. That's very important. So we use all technology available, in the medical field at our center. We have day surgery procedure. We can do the radiofrequency. We can use ozone therapy. We can use with Goldic. We can do BMAC, bone marrow aspirate. So we have all type of a treatment depending about the condition and where the patient come to us. So if the patient come to us in here, so we need to treat the acute stage. Patient come at this stage, we need to rehabilitate his disc and let it revamp again. And that's very important. Otherwise, can it continue, to go down and down and down. So I tell the patient, do not ignore the signal from your back. There's pain. It means there's something not right, something not wrong. You need to fix it.
Okay. So, you have many patients are approaching you every day by telephone call. They are calling you for the consultation. People are coming from abroad also, from outside countries also coming here. When I come to the reception, I saw that many people from other Dubai, other than UAE, they are coming here, for the consultations and kind of thing. So my next question is, sir, when these people coming over here, how many days they want to stay here? They want to stay here for a long time period. As per your previous experience, I am asking.
Sure.
Or they can come in the morning, leave in the evening, something like that. Or in-house people are staying here. What kind of things are they doing?
About 1/3 of our patients come from outside the UAE.
Outside UAE.
We have, from Africa. We have people come from Saudi Arabia. We have people from Europe. We have people come from Russia, from Switzerland, from UK. We have very international group. We have a lot of people from Iraq, from Iran. So we have what called condensed program. What we do with them and recommend, that would do like consultation with them on Zoom
call.
So they will send us the record, we'll review it, we'll put all the information, then we can have Zoom call. We get more information from them.
Okay.
And then based on what we collected, we send them what called treatment protocol.
Okay.
Put treatment plan for them based on this. And what we have really, the average person, depending about their condition, average person about between 10 days to 2 weeks would be great. Now, some people come with what's called spinal cord injury, like, Superman, injury. That's needed, first of all, a little longer and multiple visits. We have multiple patients coming on a wheelchair. We have patient came in actually from Florida.
Oh.
Wind up coming to us. She just discharged last week. And she was with us for 40 days. She was in a wheelchair. She was a helpless case. She cannot walk. Her condition progressed over 2 years to a point that she cannot walk. She came in a wheelchair. So that she needed.
How old is she?
Actually, she's 62-year-old. Very, Vicky, very nice lady, and we made actually story on her because she improved so much. She was in tears because she said, felt like I'm paralyzed for life.
Oh.
That's really how she was. And she told us how many centers she went to in the world. And somebody, tell her, come to American Spine Center, come to Dr. Hakim. They have a great team there. So we saw her, we evaluated her, we treated her. We get her very intense. And I said, she had like a spinal cord injury. For almost 40 days, we have intense treatment for her every day, twice, as in outpatient. We did stem cell therapy for her. We did a lot of therapy with ozone. We gave her alpha-butyric acid. We really treat her completely. And she left from here walking with tears.
Appreciate.
We teared ourselves because I told her, I'd like to see you get out of this wheelchair before you leave from us. I said, you promise? I said, I'll do all my best for that. And really, that happened.
This one point I need to highlight to all my audience. See, Dr. Hakim, their team, American Spine Center, they do Zoom consultation. This is good for the patients actually.
Absolutely.
Because if I have a problem, if I am in India, or if you have a problem, you are in any other country, Africa or America, wherever. If you give a consultation for the patients by Zoom call, at least they can talk to you. Okay, doctor, this is my problem. Like this, you can give a verbal guidance that will be more comfortable for them, before they travel.
100%.
So the team, any patient can contact you anytime for this kind of Zoom consultation, right?
Exactly.
You can give a second opinion, right?
Exactly. That's really what we do all the time. We always recommend that for the patient. Always acquainted with the treatment plan.
Yeah.
They prepare themselves, and we know what to expect. Then when the minute they come to our office, they are started the treatment plan. We set it up and we go about it. Yes.
That's good.
Yeah, we have actually patients come from Siberia. And we have patients came from Washington, Seattle in USA. This is the furthest people who came to us, honestly,
Yes.
But most of the people coming within like almost 3-4 hours flying from our region.
Correct.
From Europe, Africa, Saudi Arabia.
The main, what I say is that we have do so many journeys. Professional journey, medical journey is the most stressful journey that we are facing, in sometimes. So once we meet a doctor like you, and doctors are like gods. They are graced with the God's hand. So especially if coming with a pain, back pain, I had this one when I had a sports before. Sometimes I had a back pain. So by Ayurveda we cured when I was in India. So non-surgical kind of things are really appreciated, to be honest.
Absolutely. And our record, by the way, showing that 91% success rate. We serve our center as a second opinion for insurance company. And they said over 3 years for the cases we have sent you, they sent already hundreds of cases that they did not do surgery. 91% of them, they have successfully treated long-term with no need for surgery. Okay. And they did the study on us, not us.
They did the study.
But truly that was a third party, and they use it, was insurance company. They use it as a case model when they do in insurance companies, arena, and they tell them like, okay, this is what we did with American Spine Center. We send them all through hundreds of cases. This is the outcome.
And as you say, you had a 91% of success story. So my audience need to listen some of the examples, critical examples that you had done in your previous history. Just say 1 or 2, 3 examples, then they will understand that what kind of patients are normally coming over here.
Really, the patient coming, mostly recommended to have surgery from multiple sources. So we tell them, okay, yes, you can be treated surgically. It's an option. But we have an option for you treated non-surgically. And we go over the detail of the problem and what led for that. And, the patient said, I never knew my problem like this. Unfortunately, when the people come to see a doctor, when they surgeons look at it and it's rightly so that, okay, how can I get this disc out and fix it? He's trained to go and cut this out, fix the spine, and that's it. That's his training like this. And he's rightfully so. Nothing wrong with that approach. But there's something called more 360 related to that. And I always tell the patient, if you do not do the rest of the treatment, your surgery fail. And that's really what's missing part. Most of the patient and at times the doctors, do not really follow through. In USA, if the patient recommend to have surgery and they need it and they are smoking, the surgeon refuse to do the surgery for them because it's failed. Because the problem with smoking that you have less blood supply to the disc. Now, if you're going to cut and open and go all the way to the disc, you're going to create more injury. Then you need more blood supply to repair the cut itself. So the chances of losing and having poor outcome from surgical intervention in a smoker are much higher from non-smoker. So we are really stress this, and we give them the program how to stop smoking. Really give them complete program, and that's very important.
How to quit smoking?
Yes, of course, we have a program for that. How to quit smoking.
Okay.
Yes, absolutely. It's 4 stages.
4 stages.
Yeah, you quit smoking. The most important thing, how to quit smoking, you make the decision. The rest on us. When they make the decision, they understand the consequences of continuing smoking, then they are convinced. Matter of fact, in USA, I was very famous for my patient to take their cigarette and break it right there in the office and let them break it. Because they want to feel like they
did it by themselves.
I said, okay, go and break it, and he will break it. And every time somebody do not quit smoking, I take the cigarette packet and I break it for him and throw it. Because really, I emphasize that. And thank God, people, really quit smoking. They never thought they will ever to quit smoking. The interesting things, after they quit smoking, said I cannot believe how I was. Not only the back pain, the whole life. They are so much energetic. They have much breathing, taste better, sleeping better. Everything is better.
Correct. So, doctor, you said an example about one patient come from California regarding that injury. Just say 2-3 other more examples. Then it will connect to the people. Even many people are facing so many issues for the back pain. Many of them ignore. Yes. What they do normally is when they have a back pain, they put some balm or oil, just heat it, they leave it. But when it's coming slowly, they can't walk, then only they will go to the doctor. The main reason they are committed to the family, they are committed to the work, they are committed to many other things. So they are not caring their health.
Yes.
So we may have 100 of problems, and when the health problem comes, all 100 problems become zero, like as you say before.
Yes.
So tell some examples to connect with the patients who is suffering this kind of things.
Actually, we have really hundreds of cases. It's interesting, recently, Omar. He's Omar, 35-year-old gentleman.
35-year-old.
35, and he's young, strong, very strong. And, he was active in the gym. He's very go in and out in the gym. And then he did the wrong move in the gym. And all of a sudden, he has completely discriminated his L4-5 level. L4-5 level. And he has severe pain. He cannot even get out of the bench at that time. He had to be helped. And he went to the emergency room. And he'd been given something for pain. After that, an MRI was done showing that big disc pushing on the nerve. And he started developing called a foot drop. He started weakness in his foot. He cannot walk on his heel. So he saw almost 6 doctors. Everybody said he needs surgery, he needs surgery. Then somebody came in and said, okay, go to American Spine Center, go and see Dr. Hakim. They have a great team there. So he came and saw us. So we evaluated him. We saw his MRI. We do neurologic examination. We did EMG for him. It did show that he has problem at the level L4-5. His foot drop is not complete. I said, look, surgery is an option for you. It's not the wrong option. But if you want to try non-surgical, you have a chance. We can control you. Yeah. And he was taking multi-medication, Lyrica, Tramadol, NSAID, and really in severe pain. He has to be held with 2 people just to come to see us. So I said, no, I like to go non-surgical. So we went really aggressive program. We went and gave him a special injection. We gave BMAC injection along with ozone therapy for that. And then, the pains got better, almost in a few days got, better. We give him certain medication to relax the muscle. We find his vitamin D is very low,
Right. It is very low.
very low. I never even recognized that. It was 16. And that's terribly low. It should be 60, 70. His B12 and the low normal as well. That we need to be this. So we went ahead and replenished that, Plus we give him something, Theogamma, which really help repair the neuropathic pain that the patient has. We go with IV, then we give it, oral after that. We did intense course for him, almost every day, therapy with the IDD machine. In 2 weeks, he started walking by himself. His pain went down almost 85% better. And in about 1 month, he went back complete life normal. And we give him program that he need to do. We put him in a maintenance program that he did about 20 sessions of IDD. Then we put a maintenance program that he had to do 2 sessions a month. The reason for that is, one is to keep going with this. Number 2, to emphasize the lifestyle changes. To me, this is very important because I don't want this patient just to go, haywire and just go back to wildlife again. You have to do this. You have to build up a core muscle. He had a little bit overweight issues. We work on his, BMI was a little high. We work on that. We lowered his weight, and he said, I feel so much better. I never felt that good in my life. Not only we get his back pain, but get his energy, his metabolism, his sleep improved. He was very, circadian rhythm was very poor. He would go, 2-3 o'clock at night, wake up early. So it's kind of very, young man, 35-year-old man, life. So we really put that on track, and he become so unbelievable, better. He said, I never felt that good in my life. I hear it so much time. This is probably the best reward for me, to really feel I did something to somebody. And we have also a woman, Mariam. She's 27-year-old, businesswoman. She has her own business. She travel a lot. She traveled business. Emirati. And she traveled business. And she said, I told her, she came to us one time. She was in a meeting and she was in the gym in the morning. And then the meeting started having pain in her back, numbness, tingling, this. Then by the evening, she felt I have burning, feel like fire in my leg. And she was in Paris at that time. She was taken in the emergency room. And she, told her that you may have a disc. They did MRI for her and they told her you have a disc and I think you need to do surgery. So, it just happened to me this morning. So but your disc is so big. She refused that. She came back to Dubai. She came to see us, and then we really evaluated her and said we can nicely treat you, non-surgically because your disc is kind of new and clean. We can easily take care of it. And she went through the process and we have to do stem cell therapy for her twice. And really she did so much better and she went back completely her lifestyle. And we advised her, okay, do 1, 2, 3, 4. And she was also low on vitamin D, by the way. And she used to drink shisha, by the way. Shisha, people think, shisha, maybe 2-3 times a week is fine. Shisha as bad as this. Not only remember when you smoke shisha, you sit in the smoking section. And you're not smoking only your shisha, you're smoking everybody's shisha around you. So it's really...
Feeling guilty.
Yeah, it really contaminated the place. So I really emphasized, good lifestyle because we cannot, the body cannot take too much hit. Now we're finding out the way, and this is very important. People, we find they have what called microplastic in their blood. And remember, we drink and eat with a lot of plastic instrument. Our hot coffee in the plastic, our hot tea in the plastic, our, lunch, you make it in the plastic. You look at your home, open your refrigerator, you find everything in the plastic stored by your wife. Look at your sink, everything in plastic. Your toothpaste, your cream, your shampoo, everything in plastic. So we are loaded with plastic. Then start coming up to show up in the blood. Now we do tests, we call microscopic, to see if you have nanoplastic in your blood. And we're finding people, even young people in their 30s and 40s, have so much plastic. That plastic, contaminates your system. And the more plastic on this, the more problem, fatigue, body ache, memory problem, affect your sleep. And we find out people, 60% of the Alzheimer people, they have plastic in the brain. People who have a stroke or heart disease, they have plastic in the atherosclerosed area. So really, this is a very toxic material coming from petroleum, and we take it in a big amount over years, 5 years, 10 years, 15 years, 20 years. Look at us.
So this plastic, you said about a blood test is it a test to understand what content is in our blood or something?
Yes, yes. We take a drop of blood and we look at it under a microscope. We're finding a lot of things, predominantly plastic. And the good thing is, if you find it, we have very nice treatment for that. We can use ozone therapy. We can use photobiomodulation. We can methylene blue, vitamin C. All those are cleansed. We detoxify the body from plastic, and you feel so much better with energy, less pain, less headache, less fatigue, poor concentration. When you really cleanse your body from those microplastic in your system.
Okay, doctor. Anyway, thank you so much for your wonderful time with us to convey this kind of very informative messages to the audience, because the people are deserved to get kind of experience a doctor like you. Because normally the main thing for the medical problem is nobody is getting proper awareness.
Agree.
So lastly, you can give some advices to the people how to take care of your health, the body in case of the back pain and kind of things. Then we can wind up the session.
Well, thank you again very much. I believe this is very important. I have simple recommendation for my patient. I like simple exercise they need to do every day. 5-10 minutes in the morning, 5-10 minutes in the evening. That's number one. Number two, make sure all your vitamins at the highest level. Mm-hmm. I was telling the patient, like you said, my vitamin D level like everybody else. That's not good. So make sure all your nutrient, all your vitamin at the highest level.
So how frequently we need to do the blood test?
Well, you need to do once.
Once in a year?
You need to do once, and based on what you have, then you have to have a program, because we also, when we get to the highest normal, we do what's called maintenance program. We keep it high. Of course, exposed to the sun it's marvelous. It's energy. I sat in the sun today, 20 minutes today reading my newspaper. I love to sit in the sun. Your B12 is so essential. You have to take it also from your natural sources. We have the natural source for that. We guide the patient. As well, you have to do breathing exercise. It's very important. Sleep, we call it the master switch. If you do not sleep well, everything's gonna collapse. So all those simple things really here, and definitely overweight issue. Make sure you eat a lot of vegetable, a lot of fruits, and make it that you like. It's not something you forced. I really probably more than 2/3 of my meals are fruits and vegetables, and I enjoy it. I really enjoy it. I eat everything. I never say I don't want to eat this. I eat everything, but in really, reasonable amount. I'm more content to our vegetables, more fruits. I drink a lot of juices, natural juices. I take pomegranate, I take apple, orange juice. Everything that really I don't want to say I don't drink water. Honestly, I don't drink water. I drink all juices, I don't want to advocate that, but this, again, something I love. Really, when I'm thirsty, interesting. I don't drink water until I go home, because my juice is sitting for me in the fridge. Yeah. So I go to 1 or 2 bottles of juice. But remember, they are the plastic as well, unfortunately. See how much we are exposed to plastic. Yes. But all this, as much we can use, glass, silverware and dishes, the better. Especially don't drink too much hot drinks in plastic cups. That's really no for me.
Anyhow, thank you, doctor, for your wonderful time with us. So here we are winding up from AM Health Hub. So I believe that doctor gave a wonderful advices to everyone. Thank you so much.
AM Health Hub, your trusted healthcare partner.